Good afternoon and welcome to United TV. This is our Bariatric Friday session. Uh, we are going to have another episode here at United Medical, United TV, and Dr. Isaias Irgau is going to join me as usual. Today's topic is something we don't talk about enough, although we repeat, and then people can go to our playlist and then check them out, but we want to make sure that this is being discussed and available for people. Um, why do patients drop from weight loss surgery programs is one of the most challenging issues for our patients, understanding and finding the reasons. It's not always about the willpower. Sometimes it's fear, sometimes it's finances, sometimes it's just the life it is. And we are going to explore these barriers and see how we can actually help our patients to better understand where they are coming from and what we can do for them. And Dr. Irga is going to join me, and we are going to start our discussion. Now, Dr. Irga, we discussed this topic so many times, but in different ways. Every time we do these, we are able to bring something more to this. Um, there are a lot of process with the bariatric. It's almost like bariatric is it's kind of like maybe discriminated in a way. So we have to go through so much. Some of them are maybe the industry itself, but some of them are clinically needed because patients we deal with are complex patients. So there are medical clearances, the mental health screening, dietitian visits, and the support group attendees, and insurance pre-approvals, which becomes more and more difficult these days. And I'll probably do one of our 2 p.m. sessions just for that to address some of the issues. Now, patients who have emotional and psychological factors for some of these reasons, financial, as I mentioned, insurance changes, like one of the patients this morning in the case conference lost the insurance, and the other one had no bariatric benefits. So the struggles with pre-surgery weight loss requirements, because some programs, some insurances, they ask you to lose weight before you can actually qualify for weight loss surgery. It's kind of oxymoron itself. Like
Right.
when you are when your main problem is the weight loss, and then you are being told, I'm not talking about our 2 weeks diet pre-surgery for the liver. I'm talking about the actual weight loss that patient needs to have. We all want that, but if these patients were not chronically ill, they wouldn't be in our offices. So, and a lot of other things, this is kind of impacting everyone. So from someone who sees these patients every day, pre-post surgery, and understanding them better than everyone else probably, what's the most common reason for patients to drop out of the bariatric surgery program?
Certainly, apprehension and anxiety or fear, if you want to call it, is a major factor. As you said, the issue of dropping out from the bariatric preparation program is significant. In some programs, it can be up to 50 to 60% dropout rate, which means that 5 or 6 out of 10 patients end up dropping out through the program. We actually do way better than that. Our program is really, really good because of the structured care coordination follow-up that we have, and we really handhold our patients through the process very, very well, and we support them, and that helps. Still, we do see a dropout rate as well. The preparation is clearly necessary. We want the door to be open for people to be able to get bariatric surgery, and they don't have to climb a wall to get there.
Right.
Many insurance companies do that, as you mentioned. They demand either weight loss, or if patients through the process lose weight, they say, oh, you cannot have surgery because you've lost some weight. All those obstacles are nonsense. They're not necessary. But other preparation processes and steps are very necessary, as you mentioned. And as patients go through that, sometimes it takes weeks, sometimes it takes months, patients in the process can fall through and they don't complete the process. They fall out. And As I see it, very often one of the concerns is apprehension, either because they've never had surgery,
Right.
they're worried about anesthesia, or sometimes because these experiences they've had with diets and trials in the past and the continued and recurrent failures they've had traumatize them, and they feel they may fail even with surgery. They really fear this as well. So all those things need obviously support for patients to be reassured, but they are real, issues. The fear, the apprehension, the concern. All these are real. Patients will think about what my life will be like after surgery. Will I have the ability to use food as a coping mechanism like I do right now? Will I not be able to eat certain things? All these are concerns that come up and add up to slow down the determination and that patients have at the beginning of the process.
So the one of the issues that we have with this group is the fear. Um, Now, how much of a role that fear actually have for these patients with the lifestyle changes? Um, is this one of the main factors because of the changes that they think they are going to have or they should have, and the fear that's involved with that? What's the role of the fear?
I think it's clearly there, right? I mean, I see patients expressing apprehension about what their life might be like. Very often, before patients come to our office, might have considered bariatric surgery. And even then, it might take them a long time before they pick up the phone and make the appointment, precisely because of these concerns and fears. And that lingers through the process as well. Yes, the stomach will be smaller, so what will my eating habits be? Well, how different is my life going to be? And is that something that I will be able to sustain? These are real questions. They come up, but they can come up with any type of surgery if you think about it, Kemal, right? I mean, if somebody has cancer of the stomach and the surgeon says, I'm going to remove 80% of your stomach, that patient is not going to hesitate because they are facing cancer. Yes, that patient will know that their stomach is going to be small. They're not going to be eating like before. They're going to go through anesthesia, and yet they go through the surgery because it's cancer. The problem we have, our challenge here is we have not been able to translate in the mindset of our society that obesity is just as dangerous as cancer. It cuts people's lives considerably.
Definitely.
And also the illnesses that go with that. But in part, as we have spoken in our sessions, it is because of society's view on obesity as well. Obesity is viewed as a lifestyle issue, not as a health issue. And when you look at it in that way, then you look at treatment as optional rather than mandatory. And that may be the challenge we're facing.
Absolutely, absolutely. So, what are the early warning signs you notice with the patients who may disengage from the program?
Yeah, I mean, we see that, and you see that in case conferences as well. Patients miss appointments, right? Our care coordinators work very hard to schedule a cardiology appointment, echocardiogram testing appointment. They will schedule a psychology appointment, a nutritional appointment. They will send them slips for them to have the lab work, and yet weeks pass on without patients having done any. And also, they may miss appointments with the surgeon for a follow-up, with the nutritionist. All these show you that that patient may not be as committed as we want them through the program. Now, there may be many reasons for why that is happening, but clearly that gives us a hint that that patient will require way more support than others. And I'm really happy with our care coordination program actually because they are on this so well, right? When they see that patients are having difficulty making the appointments, they text, they email, they call them, they will change and switch the appointments to suit their needs. So they do all that. But even with that, we see some patients really not following through.
So, this week, in our case conference process, we have, I think, 5, 6 different lists, a list of patients. So, based on where they are, which stage they are.
Yep.
And one is our special list.
Okay.
Sometimes our coordinators, they identify the patients based on, they may have some specific problems with the process. it may be related to the bariatric benefits. It may be related to patient not being able to make their appointments, not being able to reach to the patients. But when we look at average number of points that patient needs to hit, that's about 12. So this is like the cardiology clearance, which may be 2 or 3 visits with one initial visit, and there may be an echo and nuke, HSD, home sleep study for sleep apnea, EGD, and then psych appointment, and then medical clearance, and then there may have some follow-ups with us, and maybe 2 to 4. We average about 3 nutrition classes. They need to get their blood work done, so it's a lot, right?
Yes.
So this was one of those weeks where maybe I felt a little bit more passionate or affectionate this week. I disagree with the reason that we were putting the patient on the specialist, because I'm like, hey, this patient already completed 5 appointments.
Yeah.
So, and BMI 55, being able to get out and deal with all the issues that we are talking about today, and just because they miss one nutrition or one cardiology test, or they weren't able to get their blood work done, obviously we want those things to be in a timely manner so then we can actually project the surgery date. But if they are able to go through certain things and that they need a little bit more push, and that's how we design our program. So we are not going to actually, I don't want to put any negative spin to the patient communication. I don't want to even say, hey, you didn't make it.
Right.
Like, hey, we understand you have some challenges with this appointment, but when can we see you next? That's because this individual could be one of those people who already have a lot of rejections in their life, a lot of fear in their life, so a lot of judgment that they deal with. So it's okay if they lose 1 or 2 appointments. So we don't want to just label them right from the get-go non-compliant. So we are, trying to make it a little bit more. We are trying to be more careful.
Right.
So, because again, if everything was smooth, then we didn't have to do this today.
Right. Absolutely.
So, and we are here every Friday. That means there is a need for this.
Of course.
Now, financial stress is one of the major concerns. Now, I mentioned earlier with the insurance challenges and the cost factors. Does that have impact on the dropout rate?
I think it probably does. It probably does. Clearly, the complexity of insurance plan arrangements and the inability really to navigate them leave patients frightened about what their responsibility might be for any type of encounter they have, right? And we're proposing here they have to see 3 nutritionists, they have to see a psychologist, they have to have endoscopy, they have to see cardiology, they may have to do an echocardiogram, and maybe even other tests, right? With all that, they are worried, right? They are concerned, what will my out-of-pocket expense be, right? And that is a real concern, essentially. Now, very often, there are insurances who write out, they refuse to cover any bariatric services, which is ridiculous in this day and age, but we do come across them from time to time, of course.
Well, how many peer-to-peer
we do, of
meetings
course.
you have to do?
Yeah, exactly.
So if you want to elaborate what peer-to-peer
yeah,
is.
essentially what happens is that, we would look at the insurance plan, and the insurance plan would clearly detail what the patient has to fulfill in order to qualify for bariatric surgery. And the patients will have that, and yet the insurance company will say, no, we're not going to authorize that. And then we appeal that, and we ask, look, we cannot have a clerical person somewhere within an insurance office make this determination. I, as a clinician, need to explain to another clinician what the need for surgery is, what this importance of this treatment is. So they allow us to talk to a medical director, and that allows us really to explain the clinical need, and very often we will prevail by doing that. So, but it's another additional step that we have to go in order to get treatment that is so necessary to begin with. We should not have to do that. But clearly these obstacles are there. Now, the important thing that patients need to understand is that the surgery will never be done unless we have an authorization beforehand from their insurance company. So they shouldn't be worried that we will do the surgery and then they will be charged for it. They will know upfront whether their insurance company will cover it and what their insurance company will cover it. This is important. As your organization, Kemal, supports us with the billing department and with the insurance processing people that will help patients understand exactly what their responsibility is. So they will know ahead of time what their responsibilities are. I don't want patients to think that they will go through a process and then at the end, have the procedure and not know that the coverage will be there or not. They will know upfront whether coverage is there or not.
So the challenge, we use the insurance, the term insurance, but what I also want our patients to understand is you actually don't have an insurance. If you are working one of the big corporations, most likely you have a self-funded plan. So those are employer plans.
Yes.
They utilize the network,
Yes.
But that doesn't mean that that's your insurance.
Yes.
Your employer decides what your benefit is.
Yeah. Yeah.
So, for example, with Highmark, if you get your insurance directly from Highmark, they have different levels. If you choose one of their templated plans, bariatric is very rarely excluded. But what we know is there are employer specific ones, and that's not, again, if you have, let's say, Highmark, and if you have, let's say, if you work for Christiana Hospital, and if that's going to be on the card. So chances are, in the case of Christiana Hospital, your employer is Christiana Hospital, and they determine
what the benefits are,
how you are going to qualify. You may have the benefit, but then they may say, instead of insurances requiring 1 or 2 or 3 maybe max nutrition class, they say you have to do 6 consecutive nutrition class.
Yes.
That's coming from the employer. So understanding that from the patient standpoint, I think it's important because in some cases they really, when they don't know what it is, then they think it's something that their insurance is doing. That's not the case. Insurance is just the facilitator there. And although insurance, like as you were mentioning earlier, it shouldn't take 2-3 weeks to do the authorization. If you don't have enough staff, then don't put the authorization.
Right.
So there are some cases with Aetna these days. It's 3 weeks. While we finish everything, now we are waiting for authorization, and this patient already is going through a lot. Yeah. And all of a sudden, now we have to wait for 3 more weeks for the authorization. That's really something that they should be looking into.
For the patient, very stressful.
Definitely. Yeah. Now, speaking of stress, how does social support or lack thereof affect patient success or failure in the bariatric program?
To a good extent, Kemal. It's critically important to have good social support, and we see the impact of it in the practice. We see that patients who have a good social network that supports their endeavor, that they are really cheering for them, first of all, are less likely to drop out from the program, but they do better overall. On the other hand, if friends, relatives are giving negative feedback about the whole process, if they're not really supportive of the fact that the patient is trying to become healthy by getting bariatric surgery, then that will impact them. You have to be much stronger psychologically to overcome that negative energy that comes from your social work network if that social network is not supporting you. So like in any other endeavor, like in any other effort that we make, the support from our family, loved ones, friends is very important for us to succeed. And the same for bariatric surgery. In fact, even more important for bariatric surgery, because a lot of people are thinking, that person should not have surgery to lose weight. They should be doing it by themselves, because the view on obesity is still a biased view, right? People don't understand how hard, difficult, nearly impossible it is to lose weight once you get to a certain level.
Right.
If you are 200 pounds over your ideal body weight, if you're supposed to weigh 150 and now you're weighing 350, I dare anyone to try to lose that weight without any support, without any medical input,
Hmm.
right? And yet people think that that's the case. Eat less, exercise more, as if it was the easiest answer, right? With that kind of prevailing situation, if you don't have really somebody who understands how much you're struggling and how important it is for you to get this treatment, and they don't support you every step of the way, then it is obviously very likely that you lose confidence in yourself, and
Right.
you say, maybe I should do it any other way, and then you drop out as well.
And
So it is
again,
important.
people can lose weight with some of these methods, but that's not what this program is for.
Right.
We are talking about patients with high BMIs
Yes.
or a high comorbidity and a lot of different things.
Yes.
That's why this is labeled as a chronic
Yeah.
disease.
Absolutely.
So,
Absolutely.
I mean, even our president is morbidly obese. He thinks he's 216 pounds. He's 286 pounds. So, and he could have used this if he knew that he was going to run for the office second time. So, so when I say our president, so I was talking about politics. So, but the thing is, I mean, like he could have been prepared for this if he had the surgery, but he's lying to himself. He says he's 216 pounds. I am 220 pounds. How is he like 216 pounds, right?
Oh, yeah, no,
So,
absolutely.
but then he's still running for the office. So now anyone who is in their 40s and their 50s, they should be looking at what's happening with people and what they do and prep for that time. So this is why also it's important to not to live with this, because it's not going to be too long if they don't do something about it.
Absolutely.
That's the other thing.
Absolutely.
So now we know some patients, they do some steps already and then they drop and then they come back. So are there any good success stories you would like to share with the patients who just nearly dropped, but then they went with the surgery and then they were successful?
Absolutely, absolutely. Yeah, I've had a few patients actually. I can remember one patient who were really a couple of weeks away, maybe about 3 weeks away from having surgery. They've completed everything that was needed, fairly extensive preparation and education and appointments and evaluations. And yet the patient wanted to have more discussions. And in the discussions, I could tell there was hesitancy, right? Should I do it? Should I not do it? Can I wait? And in this situation, is my attitude obviously is of encouragement, right? Say, look, you have to understand this is important for you. But if you're not ready for it, then let's continue supporting you,
Right.
right? Because it's important for that person to be comfortable when they're going through this process. This is very, very important. And I did support them, but then, after seeing the psychologist again and then rethinking, then they decided to go ahead. And then, when I talked to them, a couple of years after surgery and asked them, do you have any regrets about the surgery? They said, my biggest regret is not having done this 10 years ago. So after losing over 100 pounds, that is. So it is, it is satisfying for us to see that, we encourage patients to go through and then we see them on the other side of surgery with the success, with the improvement in their health and the happiness they have now because their quality of life is so much better. But this, reticency through the process is in a way natural. Anybody would be expected to have anxiety, apprehension, but we're there to support, we're there to sustain. And it's clearly important to understand that everyone has apprehension, everyone struggles with one or other challenge. Everyone that has been successful has gone through that process, essentially.
So I want to talk about two of our patients recently.
Yeah.
We had, and the reason I want to actually bring them up is because I want our patients to understand what extent we go through. And also I want the other people who are listening and not understanding what these patients are going through, they would have a good understanding of what we do from the program standpoint. So this is a multidisciplinary program, meaning that we have different specialists working together to bring the patient up to the surgery time. The two patients, of course, I'm not going to mention names, so we don't have to worry about that. But I think that actually gave me a lot of appreciation on what we are willing to do for these patients. Now, these are the two individuals who had diabetes problem. So they did everything. So they did everything in a timely manner. All the clearances were checked. We had them extra nutrition classes. They were all checked. One of the things that we do is looking at their medication compliance. So someone with A1C 10.2, let's say, if in many cases we actually diagnose those patients because they never had a blood work, imagine. So once we find that out, so we send that to one of our specialists, endocrinologists, and or sometimes we work with their PCPs, and they start some medications and with the diabetes, and we expect that patient to respond to that, so that a couple months or 6 weeks later, with the fructosamine, then we know that A1C should be lower.
Lower, yeah.
Now, these two individuals didn't have that result. And I, in fact, had to go through this several times and see if they were really taking the medication. And I talked to them. Now, of course, my knowledge, clinical knowledge, is limited because I'm not a physician. When I was explaining those cases to you, one of the things that you said, hey, they may be, because I didn't believe that patient was taking the medication.
Okay.
They were filling it because I have my mom, and you know, who just stops the medication and doesn't tell anyone. So I'm thinking that everyone is doing that maybe in different ways. So, and then you said, no, Kemal, like this is the time for this patient to be on insulin.
Right.
That's probably why they're not, you know, we are not seeing the progress on A1C. And yet, as soon as we send them back, and in these cases, Dr. Handal's office was working with these individuals, and they were on the right medication, because doing everything that we already have planned sometimes doesn't work.
Of course.
But what we are willing to do from the program standpoint, we go way beyond. If I know about, like, I can just name you 5-6 individuals right away who are in the program. Because we are spending a little bit more time for them. So that's one of the message for me, from me, for our patients. Hey, I mean, don't worry about it. We are there to support you in any way, and to a great extent. So we should be able to you know, do this together. So that was my message. So what would be your message for our patients who are kind of discouraged or thinking about leaving the program?
Yeah, what I would say is that it is natural to have apprehension about a life-changing process and surgery. It is natural, you know, and but we're here to support. We're here to support not just at the preparation process through the, you know, coordination and the care coordinators, our nutritionists, our psychologists, but also afterwards, right? And we've been doing this for many years. Our practice has been doing this for now 25 years, Kemal. So we have a lot of experience, and we are there to help patients. So they're not going to be alone. But the critical thing for them to understand is that the most dangerous problem for them right now, the most immediate danger, is excess weight. And they have to shed that, and they have to shed that definitely. And bariatric surgery is by far the most effective treatment we have now. And bariatric surgery has not been as safe as it is now. Anesthesia, the procedure itself, the preparation, because of the implementation of many, many protocols through the Center of Excellence criteria that we have, right? So, yes, apprehension is expected and natural, but they're not alone. We're here to support them. We have support group meetings that are important, and they will give them additional avenue for them to really understand what it means to go through the surgery, what it means to live after surgery, essentially. So my message would be, obesity is by far the biggest danger, and
Absolutely.
addressing it is far more important.
Absolutely. Well, Dr. Irgau, thank you, and thank you for joining us
Of course.
on our Bariatric Friday. We hope today's conversation shed light on complex human reasons behind why patients sometimes step away from their journey. And if you are one of those patients, we see you, we hear you, and we are here for you. And big thank you to Dr. Irgau for sharing his insight as always. And I'm hoping that our patients are following us and watching our different episodes to bring their knowledge level up to speed. And we'll be back next Friday. So until next time, stay united. Bye-bye.
Thank you. Bye-bye.